Are you struggling with painful, heavy periods due to fibroids? Well, there's a way to eliminate those fibroids without having invasive surgery.
And that is the uterine artery, and that is supplying a very large fibroid. And we'll get a better look at that once we get inside that artery.
Norton Healthcare interventional radiologist Dr. Darren Rapishti works to create relief for a patient struggling with heavy menstrual bleeding. This minimally invasive procedure is called uterine fibroid embolization.
So that is a very large fibroid in the pelvis with countless arteries supplying it.
About 70 to 80% of women have fibroids, which are non-cancerous tumors in the uterus. Most women experience no symptoms, but for some, the fibroids can cause very heavy and painful periods.
Frequently, women will come to me and their periods, they might use a pad with a tampon, changing that every 60 minutes, every 90 minutes, over the course of several days. Their periods might last for 10 days, 12 days. Very heavy and really affecting their ability to enjoy just everyday life.
Obstetrician gynecologist Dr. Anna Feidelson, with Associates in Obstetrics and Gynecology, part of Norton Women's Care, says women looking for relief have many options. Over-the-counter and prescription medications can help treat the symptoms. Then there's surgery. Some women opt to have a hysterectomy, in which the uterus is removed. Other women choose to have their fibroids surgically removed through a procedure called a myomectomy. And then there's uterine fibroid embolization, a minimally invasive procedure that blocks the blood supply to the fibroids, starving them of nutrients and causing them to eventually die off.
And we have to very carefully inject these particles because we only want them to go forward into the fibroid and block that circulation. We don't want to block any other circulation.
This is done by threading a catheter through the leg to blood vessels that supply the uterus.
And as you can see, the main artery to the uterus on the left side is still open. But all of those little tiny arteries filling that fibroid are no longer there. That's before and after.
I think it's a great procedure, again, because it allows a woman to keep her uterus, and she doesn't entail the surgical risks that go with having a hysterectomy, and she can get back to being herself faster.
Uterine fibroid embolization isn't for everyone, including women who want to get pregnant in the future. If you think that you might have fibroids, call 502-559-2800 to see a member of the Norton Women's Care Pelvic Health Team.